years, the healthcare community has been getting ready now for a nursing shortage.
As the population continues to grow, this projection that's been tracked for years is getting more urgent. Morgan Hightower from our Nashville affiliate WKRN looks at this shortage new at 4.
The door is always open at Neighborhood Health at downtown. It's one of the reasons nurse practitioner Holly Klein chose to work here.
I love it, and I love my patients.
Patients with few healthcare options. Klein wanted to work with the underserved, but with a lower salary and the cost of nursing school, it was an expensive decision to make.
Nurse Corps kind of helps you be able to serve the people that you really want to serve and not go bankrupt.
Nurses accepted into the Nurse Corps loan repayment program get up to 85% of their student loans paid in exchange for working full-time in a critical shortage facility in a high-need area. The need for nurses across Tennessee growing. A federal study predicts a near 22% shortage in this state by 2030. A concern Dean Linda Norman has been studying and helping to address for years.
So we admit as many people as is reasonable.
Dean Norman leads Vanderbilt University's School of Nursing, one of the largest nursing schools in the country, averaging 850 students at any given time.
There are a lot of people who are interested in coming into nursing, but our schools aren't able to accommodate everybody who wants to come in or is eligible to come in. There is sort of twofold. There's going to be a shortage of nurses, but we also have a shortage of nursing faculty, and you've got to have enough faculty in order to admit more students.
Dean Norman points to an aging population as one of the needs for more nurses. The economy plays a supporting role as nurses put off retirement after 2008's recession and are leaving work earlier as the economy continues to improve.
I think we've done a really good job in trying to acquaint people with why it's important to be a nurse. And that's why we have more applicants than what we did 20 years ago.
The next step?
Being able to keep those new nurses in the workplace, in the areas where they're needed as staff nurses, is going to be a big priority for healthcare organizations.
That's why incentives like Nurse Corps are being used more in recruitment and retention, getting nurses like Klein to make sure patients get the care they need.
I don't have to worry about that student loan payment every month, which would be quite high, to do what I love and want to do.
All right, that was Morgan Hightower reporting. Now, according to data from the Labor and Workforce Department in Tennessee, a registered nurse on average earns $60,000 a year, a nurse practitioner $96,000 a year.